And there are a lot of medical headlines this week, from COVID to how drinking alcohol impacts your heart. And joining us now to talk about some of these topics is Dr. Ben Weston. He's an associate professor of emergency medicine at the Medical College of Wisconsin. Good to see you, Dr. Weston. Let's start by talking about the heart. The World Heart Federation is challenging the theory that moderate amounts of alcohol can be good for your heart. They say even small amounts of alcohol can increase a person's risk of heart disease. What do you know about this?
Yeah, thanks for having me back. So this is a good example of where science gets complicated and science gets messy. There's been a bunch of different studies on this. Some say one thing, some say another thing. One of the problems with these studies is they get a bit what we call confounded. So you can imagine people who have a glass of red wine each night tend to be higher income. They tend to be healthier overall. So that makes it a little hard to piece out these studies and what it really means. I think the take home point is if you're having one drink a day or less than that, there's some evidence on both sides, but it's unlikely to have any sort of a substantial detrimental effect. Now, if you're having more than that, then I think you need to be careful. There can be heart problems from that. You can have strokes from too much alcohol, blood pressure, certainly liver disease and obesity. So if you're drinking more than a drink a day, it might be time to cut back. But if you're one of those one drink a day people, I don't know that I'd let this keep you up at night.
Okay. How about this other study that says more than 1 million people died in 2019 because of bacterial infections that have become drug resistant? That's more deaths than from AIDS or malaria that year.
Right, 1.3 million people in 2019 from drug resistant infections. So, what we have here is a significant problem, and it seems to be much like many infectious diseases and many diseases, unfortunately, hitting our vulnerable populations more, especially on a global scale. Countries that have less access to more advanced antibiotics, or where you can get antibiotics over the counter without necessarily a health provider's input. And so, when you're treating infections that don't need antibiotics with antibiotics, they're going to mutate, they're going to change, and you're going to get these resistant and more dangerous infections.
Have Americans been abusing antibiotics and causing the drug resistant bacteria?
Well, certainly that is part of the case as well, and especially in the past. I think a lot of healthcare providers have tightened up here. If you have a cold, if you have a viral thing, you don't need antibiotics. And a lot of times, if you have an ear infection, you don't need antibiotics. And so I think our physicians, our clinicians have gotten much better at recognizing this, but certainly there's more room to tighten down, especially with our more advanced antibiotics. We want to reserve those for the sickest of people so we don't lose their effectiveness.
Are there enough antibacterial drugs in the research pipeline, or is Big Pharma giving up on them because they're not as lucrative as other projects?
Well, it certainly is a concern. There are some in the pipeline. There's never enough, especially when you see this antibiotic resistance. You always want to have that next antibiotic that you can reach for if the first one you used isn't working.
All right, and back to COVID. Dr. Fauci, he is saying that children may need 3 doses of Pfizer's COVID vaccine for protection. What do you think about this extra shot?
Well, we certainly want to maximize protection, and we've seen across age groups that the booster is critical. It's critical for cases, it's critical for severity. It's certainly, there's new data out of the CDC today. It's critical for hospitalizations. Now, that's more for older age groups, but there's increasing evidence that the vaccine may need to be a 3 dose vaccine for younger kids as well. We also know that kids don't live in isolation. They're around vulnerable people, they're around older people. But I think the fact of the matter is we're not going to boost our way out of the pandemic, but we can vaccinate our way out of the pandemic. And when we have, 55% of 12 to 17-year-olds fully vaccinated and only 19% of 5 to 11-year-olds fully vaccinated, we have a vaccine problem and we need to get more kids vaccinated.
So, as we head into the weekend, what advice do you have for people who are concerned about going out there and maybe catching COVID?
So I think the take home point is layers of protection. The most critical layer is your vaccine and your booster. But other important layers include masking, and we're talking about high quality masking, ideally a KN95 or N95 mask if you're going to be indoors, in public, around others, and then distancing and being in open air as much as possible. Right now is a critical time period. We have unprecedented numbers of cases, numbers of hospitalizations, and increasingly numbers of deaths. So we have to buckle down. We have to be careful. It's not forever, but it is for now.
Absolutely. We all want to stay safe. Thank you so much, Doctor, for all you do as a healthcare provider. And thank you so much for joining us here on BNC, Dr. Ben Weston. Take care.